Welcome to HIV.gov's coverage of the 2018 annual Ryan White Conference. Maybe a little bit loud in the background. We are broadcasting live. I'm JEANEAN MARSH, and I'm here today to talk to two experts about some newly released data from the Ryan White program that we're very, very excited about. It's the Ryan White annual client level data, and it's the 2017 version. So one of the things I wanted to say is we do have the ability to take comments and suggestions, so please be sure to put your comments in the comment box, and we will address them if we can. So one of the things, like I said, we're excited about is the release of the data, the 2017 annual client level data. And yesterday, Heather actually, and let me introduce Heather, she is the Deputy Associate Administrator for HRSA's HIV/AIDS Bureau. And I'm also joined by another expert, and that's Miranda, and she works in our data division. So welcome both of you, and thank you so much, and thank you all for joining us today. So today, this morning, Heather actually had led a plenary to talk about the data. So we wanted to share that with you for those of you who aren't able to join the conference. So Heather, could you just give us an overview and a summary of the data that you presented this morning?
So yesterday, actually, and this morning, we reviewed some of the data of our newly released 2017 annual Ryan White HIV/AIDS program client level data report. That data is generated from our Ryan White Services report that's submitted by over 2,000 Ryan White providers from across the country. What this report reflects is not only the demographics of the clients being served through the program, but also the health outcomes of people being served by the Ryan White HIV/AIDS program. And what's very exciting about our 2017 release is that it shows that in 2017, 85.9% of our clients in the Ryan White program achieved viral suppression. This is an increase of over 16.4 percentage points over the 2012 data. In addition, it exceeds the national average of 59.8% of all people diagnosed with HIV in the country. We find this report incredibly useful internally within the HIV/AIDS Bureau. It helps inform our planning, our program monitoring, as well as providing information out to the community. In addition, we also strongly encourage community planning members, our recipients in cities, states, and clinics, as well as national stakeholders and partners to use this information to better understand the demographics of people living with HIV in the Ryan White program in their own communities, and to use that for planning, resource allocation, and implementation of needed services for people living with HIV in their jurisdictions. So it's an incredibly exciting report for us and also for all of the recipients across the country in the United States.
Absolutely. Thank you for that. I think that the data is absolutely amazing and really speaks volumes about the success of the program. So could you just tell us about the success as it relates to health outcomes of the people that you serve in the Ryan White program?
Sure. So as I said, the main and primary indicator of success is viral suppression for two reasons. One, when a person is virally suppressed, they certainly live a normal lifespan, a longer, healthier life. But equally importantly, when a person is virally suppressed, there is effectively no risk of transmission to other people. So that really is an incredible hallmark of the Ryan White program, is that we have achieved 85.9% viral suppression among the clients in our program. It speaks to the success of the comprehensive model of the Ryan White program, where we're providing not only healthcare services and medications, but also essential support services to people living with HIV. Those support services might be transportation, it might be mental health, it might be nutrition, but really those services that round out a person's healthcare needs and allows them to engage in their healthcare and achieve viral suppression. However, I think it's also important to note that although we have achieved a viral suppression rate of 85.9%, that still means that there are 14% of people in our program who have not yet achieved viral suppression. And so we know that we need to reach those individuals through different types of engagement, different types of services in order to achieve that last 14% in our program. In addition, there are an estimated 400,000 people diagnosed with HIV who are not in care. And so we also need to think about what are the different engagement strategies or different retention strategies that we need to implement for those folks who are not yet engaged in care to help them, who are outside of the Ryan White program most likely, engage in either our program or the larger healthcare system through other healthcare resources. And then last, I think it's also important to acknowledge that even though we've achieved 85.9%, there are still persistent health disparities, even among our Ryan White clients. So we know that among specific demographics and populations, they have achieved lower viral suppression. So Black African Americans have lower viral suppression. Youth aged 13 through 24 have lower viral suppression. Our transgender clients, which Miranda will talk about a little bit more, have lower viral suppression. And clients who are unstably housed have lower viral suppression. So we really need to think about how we engage with those clients differently, implement interventions differently, and plan for resources differently so that we can really decrease those persistent health disparities.
Absolutely. Thank you for that overview, Heather. So one of the things I wanted to say real quick, for those of you who have just joined us, we're broadcasting live on behalf of HIV.gov. I'm Captain Janine Willis-Marsh from HRSA's HIV/AIDS Bureau. I'm joined today with Heather Hauck and Miranda Fanning, and we're talking about the newly released client-level data from the Ryan White program. So we're going to go now to Miranda. It was something that Heather mentioned when she was just talking about the demographics of the population that we serve. So I wanted to ask you, Miranda, since you're our data wonk, to just talk a little bit more about the demographics, because typically that's what really interests people, because they want to know if they can see their clients in the data, if they can see themselves in the data.
Sure, yes. So in 2017, the Ryan White program served nearly 535,000 clients.
That's impressive.
It is.
Absolutely.
This is actually over half of the total number of people living with diagnosed HIV infection in the United States, so it's a large portion of the epidemic. And also nearly 3/4 of our population, of the clients served in the Ryan White program, come from racial and ethnic minority populations. And about 2/3 of the Ryan White population are living at or below the poverty level. In addition, our client population is aging. So for those people who are 50 and older, they now comprise 45.2% of all Ryan White clients.
That's a huge increase.
It is a huge
Absolutely.
increase. It's actually, in 2010, when we first published our report, 32% of people in the program were 50 or older. So this is actually a 66,000%
Wow.
increase from 2010, just in 8 years.
Okay.
And Miranda, if I can just jump in for a second, I think that's a really important point, is that we do have an aging population in the Ryan White program, and it's something that we have been engaging with a number of different providers and clients to better understand what the specific service needs are for that aging population so that we can plan for the Ryan White program moving forward.
Absolutely.
Yeah, so the other important point that we wanted to mention was that in this year's report, we changed the methodology for calculating or for determining whether a person's current gender. So this impacted our transgender data. In the Ryan White program, about 2% of clients are transgender, which is actually 10,000 people. So the Ryan White program remains committed to ensuring that the data for transgender clients is accurately reflected in our Ryan White services report.
That's noteworthy. Absolutely. Yeah. So we've been given quite a bit of information in this summary about the client level data. There were a lot of things touched upon. Again, I encourage you to put your comments and suggestions in the comments box and shoot them our way. One of the things that I did want to say, we've gotten a lot of information, but is there anything else that maybe we didn't touch upon? There were a lot of things talked about that you wanted to share with us about the client level data and what the program is doing to even address viral suppression, aging, and all those different topics that you talked about, Heather.
Yeah, well, I'll go ahead and start. So we're actually really excited because there's 20 new tables within the 2017 report, and this actually contains information for state level and EMA TGA level data on client characteristics, retention in care, and viral suppression. So it should be a really great
EMTGA. For those of us who are not vets, what does that mean?
So that's the eligible metropolitan areas or
Okay.
traditional metropolitan areas, but it's the cities that we fund for.
Very good.
Yes, for HIV care. In addition to that, we're really excited because we're able to drill down much further into our data than we have been in the past. And so with this, we have actually, we're contracting some work to do benchmarking for providers so that this will be incorporated into a larger data dashboard that will be published on the HRSA Hub website. And what we're hoping with this is that this will take us a step further and also allowing our recipients and stakeholders to be able to really get a look at our data, in a very helpful way.
And that was going to be my question to you. How do you propose that the states and others use the data, and how will this be helpful to them? So it sounds like you all are really doing some innovative and new things to help the states and others out. So
we're very excited.
That's great. That's great. So I believe that is the end. Thank you so much, Heather and Miranda, for joining us today in this HIV.gov broadcast. We look forward to your comments and your suggestions. We do have other Facebook Live postings during the conference, so we encourage you to sign in, take a look. Again, provide us with any information or comments that you may have. Thank you so much, and look forward to the next posting.